Good morning. Today we have a 29-year-old male patient with a complaint of facial asymmetry. Uh, we advise few tests like X-ray OPG, lateral cephalogram, and MRI. And we found out that patient is having right side microsomia. He is having small mandible on the right side, and there is a left side masseteric hypertrophy, which is kind of a idiopathic hypertrophy. And because of this mandibular deformity, his chin is also deviated to the right side moderately. Patient is happy with his right side, which is more slimmer than the left side. He feels there is a bulk on his left side because of the masseteric hypertrophy. So we'll do left side mandibular angle reduction to reduce mandibular volume, and along with that we will do masseter muscle reduction intraorally. There won't be any external scar, and we'll do his sliding genioplasty to correct his midline and little bit of advancement because the chin is also slightly deficient.